Hello everyone. I will simplify MTP Amendments 2021 for your easy understanding. MTP Act Amendment 2021. It is a big milestone, a great achievement. It has passed through a long journey. As you can see that the bill was approved by the Cabinet on 29th January 2020. Then it was introduced in Lok Sabha on 2nd March, then passed from Lok Sabha on 17th March 2020, and then passed from Rajya Sabha on 16th March 2021, then published in Gazette on 25th March 2021. Then it was implemented on 24th September, and then finally it was notified on 12th October 2021. Medical Termination of Pregnancy Act. It is all about who, when, where, and documentation, which means who should do the MTP, the place where the MTP should be done, indications for the MTP, and then the documentation. There are four major changes which has taken place after the amendment. Now, first is the indication for MTP regarding contraceptive failure, which was applicable to married women earlier. Now it will cover the unmarried women also. Gestational upper limit earlier was up to 20 weeks. Now it is increased up to 24 weeks in certain category of the women. And then after 24 weeks, it is for the substantial fetal abnormalities. Then medical practitioner opinion required before termination of pregnancy. Now earlier, one registered medical practitioner opinion was needed till 12 weeks and two RMP's opinion was needed till 20 weeks. But after amendment, now one RMP opinion is needed till 20 weeks, two RMP's opinion is needed between 20 to 24 weeks, and then medical board approval is required after 24 weeks. Then breach of women's confidentiality with respect to record, documentation, consent, etc. Now earlier there was the fine up to 1,000 rupees, but now there will be fine and or imprisonment of 1 year. Now coming to who should do the MTP. Now registered medical practitioner who has a PG degree or a diploma in obstetrics and gynecology can do the MTP at any period of gestation, provided their degree is a recognized one and the name has been entered in the state medical register. Then regarding the registered medical practitioner, MBBS doctor, now they can do the MTP at any period of gestation, provided they have 6 months of complete house surgency in obs and gynae, or they have at least 1 year of experience in obs and gynae at any hospital that has all the facilities. Then they can also do the MTP by medical method as well as surgical method up to 12 weeks, provided they have assisted registered medical practitioner in 25 cases of MTP, out of which at least 5 has been done independently by them in a hospital which is established or maintained by the government. Then again, this is a new one which has been added after the amendment, that a registered medical practitioner, MBBS doctor, they can do the MTP by medical method only up to 9 weeks if they have the experience at any hospital for a period of at least 3 months in obs and gynae, or they have independently performed 10 cases of MTP by medical methods of abortion under the supervision of a registered medical practitioner. Then regarding the opinion, now one registered medical opinion is needed for MTP less than 20 weeks. 2 registered medical practitioner opinion is needed between 20 to 24 weeks MTP. After 24 weeks, it is the medical board approval which is needed, and up to 24 weeks, opinion for MTP is given by the registered medical practitioner having PG degree or a diploma, or a MBBS doctor having 6 months of complete house surgency in obs and gynae, or if they have 1 year of experience in practice of obs and gynae. Then up to 12 weeks, MBBS doctor, they can give the opinion for MTP by surgical as well as medical method if they have assisted a registered medical practitioner in 25 cases of MTP, out of which at least 5 has been done independently by them. Then MBBS doctor, they can give the opinion for MTP by medical method only if they have at least 3 months of experience in obs and gynae, or they have independently performed 10 cases of MTP by medical method under supervision of a registered medical practitioner. Then after 24 weeks, medical board approval is required. And if it is approved, then two registered medical practitioners, they have to perform the MTP. Now coming to the medical board, after 24 weeks MTP, medical board opinion is needed, and every state government is required to constitute a medical board. Now medical board should have one gynecologist, one pediatrician, one radiologist, and any other number of members as may be notified by the state government. Now in Delhi also, almost all the medical colleges, they have constituted the medical boards, but the medical boards are not yet notified. So if a patient comes for MTP after 24 weeks, still we have to follow the old rules, which means we have to send the patient to the court to file a petition, and then the court will direct for the medical board constitution, and then medical board will decide for the termination. Now coming to the powers of the medical board. Now medical board, they can allow or they can deny MTP after 24 weeks. And MTP after 24 weeks, it is only done after due consideration and ensuring that the procedure will be safe for a woman at that period of gestation, and whether the fetal malformation, they have the substantial risk of it being incompatible with life, or if the child is born, it may suffer from physical or mental abnormalities to be seriously handicapped. So after deciding that, only board will give the opinion. Board can co-opt other specialists in the board, and they can ask for any additional investigations if required for deciding for the termination of pregnancy. Now medical board, they can examine the woman and her reports, and then they have to give the opinion within 3 days of receiving the request for MTP. And the opinion is given in the form, that is Form D. And once the opinion is given, then the medical board, they have to ensure that MTP is carried out with all safety precautions along with appropriate counseling within 5 days of the receipt of the request for the MTP. Now coming to the indications now. Now less than 20 weeks, we know there are 5 indications, same as before, that is to save the life of mother, then to prevent the grave physical or a mental injury to the mother, then if there's a risk of physical or a mental congenital abnormalities in the baby, then humanitarian ground, and the contraception failure. Contraception failure, which was applicable to married women, now it is applicable to unmarried women also. Gestational upper limit, it is increased to 24 weeks in 7 categories of the women. They are, first, they are the survivor of sexual assault, rape or incest, then minors. Then if there is a change in the marital status, for example, if a woman has become widow or divorced, then women with physical disabilities, and physical disabilities means the major disabilities as per the criteria which is laid down under the Rights of Person with Disability Act 2016. Then mentally ill women, including mental retardation, then fetal malformation, and malformations are those which are incompatible with life, and as well as those malformation which may risk the baby, that the baby will be born with a physical and a mental abnormalities and will be seriously handicapped after birth. Then 7th point is women with pregnancy in humanitarian settings or disaster or emergency situation as declared by the government. After 24 weeks, MTP, it is done only for the fetal malformation. Malformation which are incompatible with life, as well as those which may risk the baby, that the baby will be born with serious physical and mental abnormalities that will lead to the handicap after birth. And there's no upper limit. The medical board will decide, and it is left up to their discretion. And the medical board will decide only after due consideration and ensuring that the procedure will be safe for that particular woman at that particular period of gestation. Now, where MTP should be done? It should be done in a hospital which is established or maintained by the government, or any place which has been approved by the government, that is a district level committee. All government hospitals, they do not require to take the approval for MTP, but all private setup, they need approval for MTP. Thank you so much. Once again, I repeat, MTP Act, it is all about who, when, where, and documentation. So as long as 4 things are in place, we are legally safe. Thank you for your patient hearing.